Hello everyone, you're welcome again to another edition of Advocating for Children with Special Needs. I still remain your host, Oluwaseyi Obasa. This program is put together by Amo Gates Radio Communications. Today we'll be looking at the topic, Tourette Syndrome. What is Tourette Syndrome? Who are those that are most likely to get Tourette Syndrome? How is Tourette Syndrome diagnosed and treated? How can I or my loved one help improve the care of people with Tourette Syndrome? Tourette Syndrome is a neurological disorder that may cause sudden, unwanted, and uncontrolled, rapid and repetitive movement of vocal sounds called tics. Tourette Syndrome is one of a group of disorders of the developing nervous system called tic disorder. The motor, that's the involvement of body movement, or the vocal, that's the sound you make. Tics of Tourette Syndrome come and go over time, varying in type, frequency, location, and severity. If you have tics, you cannot stop your body from having them. The first symptom usually occurs between the ages of 5 and 10, generally in the head and in the neck area. These may progress as time goes on to include the muscles in your torso, arm, and legs. These may also progress as time goes on to affect the vocal cavity, that's the voicing. Motor tics generally occur before the development of the vocal tics. Now, how do we identify Tourette Syndrome? They come in different classifications. So we have the simple motor tics, we have the vocal tics. The simple motor tics, these are some of the signs: eye blinking and other eye movement, facial grimacing, shoulder shrugging, head and shoulder jerking. Simple vocal tics include repetitive throat clearing, sniffing, barking, grunting. And then we have the complex tics. The complex tics are distinct, coordinated patterns of movement involving the several muscle groups in different parts of the body. So the complex motor tics can involve sniffing and touching an object, hopping, jumping, bending, twisting. The complex vocal tics include repeating one word or phrase. It includes echolalia, that's repeating the words of other people or their phrases. It also involves coprolalia. It involves using vulgar, obscene, or swearing words. Vulgar, obscene, or swearing words. Some of the most dramatic and disabling tics may include motor movements that result in self-harm, such as punching yourself in the face, or vocal tics, which include echolalia or swearing. Some tics are preceded by an urge or sensation in the affected muscle areas. They are called premonitory urge. You may feel like you have to complete a tic in a certain way or a certain number of time to relieve the urge or decrease the sensation. Now, what are tic triggers? What are the things that trigger tics? Tics may worsen with excitement or anxiety and get better during calm and focused activities. Certain physical experiences can trigger or worsen tics. For example, tight collars may trigger the neck tics. Hearing another person sniff or clear the throat may trigger similar sound. Tics do not go away during light sleep. They don't, but are often significantly diminished they go away completely in deep sleep. Although the symptoms of Tourette syndrome are unwanted, are unintentional, that's involuntary. Some people can suppress or otherwise manage their tics to minimize their impact on functioning. However, with Tourette syndrome, often reports a substantial buildup in tension when suppressing their tics, to the point where they feel that the tic may be expressed against their will. Tics in response to an environment trigger can appear to be voluntary or purposeful, but they are not. So what are the disorders associated with Tourette syndrome? We have attention deficit hyperactivity disorder. We have OCD or OCB, obsessive compulsive disorder or obsessive compulsive behavior. That's unwanted thoughts, ideas, sensations, obsessions, which may make someone with Tourette syndrome feel the need to perform behaviors repeatedly. Repetitive behavior can include hand washing, checking lists, cleaning, and can significantly interfere with daily life. Anxiety can also be a disorder associated with Tourette syndrome. Learning disabilities, behavioral conducts and issues, that's aggression, anger management problems, problems adjusting emotionally and socially. Insomnia, problems falling asleep or staying asleep. Social skills deficit or social functioning difficulties. People that cannot maintain a social relationship. Sensory processing issues. Touching, those with the tactile dysfunction. Taste, smell, sound, or movement. Although students with Tourette syndrome often function well in a regular classroom, but ADHD, learning disabilities, OCD, frequent tics can greatly interfere with academic performance or social adjustment. After a comprehensive assessment, students should have access to an educational setting that meets their individual needs. Students may require tutoring, smaller or special classes, private study areas, exam outside the regular classroom, and other individual performance accommodations, and in some cases, special schools. So it depends on the severity of TS that person has. Who are those that are susceptible to having TS? So in most cases, TS involves the interaction of multiple gene variations and environmental factors. Although the cause of TS is unknown, current research points to abnormalities in the certain brain regions, which includes the basal ganglia, the frontal lobe, and the cortex. Circuits that connect these regions, neurotransmitters, are responsible for communication between nerve cells. Such neurotransmitters are the dopamine, serotonin, and the norepinephrine. Okay, so how do we inherit TS? There are so many medical terminologies that I don't want to go into, but I just want us to understand that it may take time to get all the diagnosis done. Most importantly, before I go on, most importantly, please, there are medications that can be used if it's severe. Such medications are antidepressants, stimulants medications, dopamine blocker. I'm not a medical practitioner, so I might not be able to give specific medications, specific drugs to buy. So you can check up with your pediatric developmental doctor to diagnose and to ascertain and recommend drugs for your child. Unfortunately, there is no one medication that can help to all people with TS, nor does any medication completely eliminate symptoms. TS has no cure. But with cognitive behavioral intervention, it can be brought down to a bit minimal. It will just help reduce the tic symptom if it's mild. Psychotherapy can also help individuals cope with the disorder and deal with accompanying problems like ADHD, depression, anxiety, and OCD. Please note that there are no blood tests that can be done. There are no blood tests needed for diagnosis. No blood tests. If at all, there are going to be neuroimaging studies. You could be asked to do an MRI or a CT scan or an EEG study. If you are recommended for a blood test, it is not to diagnose TS. It is to rule out any other condition that may be confused with TS. Okay, so how can I or my loved ones help improve care for people with Tourette syndrome? Wow. Just like I said last week when we were talking about dyslexia, love, support. Tourette syndrome is no respecter of age, person, sex. It's no respecter of race. It's no respecter of ethnicity. Currently, like I said, there are still researches going on, but for these people to live and lead a normal life, they need love, they need acceptance, they need... Children with Tourette syndrome can make good with their future. They do very well if the society understands and accepts their disabilities. We have them as teachers, we have them as engineers, we have them as long as they are not placed in dangerous environments where harm can be done to them. If it's someone with mild TS, he can function anywhere. While we are still running therapy and managing the one with the severe TS, we can also put them in vocational institutions. So it's important that we get a therapist and get the diagnosis done so that it can help manage Tourette syndrome. It's also important to understand that genetic tendencies may not necessarily result to TS. Instead, it may express itself in a milder tic disorder. As we have earlier said, OCD. Gender also plays an important role in Tourette syndrome gene expression. At risk, male are more likely to have tics, and at risk, female are more likely to have OCD. So, we can visit a counselor for full review of all potential hereditary conditions in the family. Once again, I want to thank you for listening and hope to have you come on this frequency this time next week. Have a beautiful week. Thank you.